Hi everyone, I'm Dr. Furzanian coming to you from my English medical YouTube channel. In this channel, I'm going to talk about medical cases that we had and different topics about health, about medicine that may be useful for healthcare providers and even for any other person. So let's start. Today I'm going to talk about one case that I've had a few days ago. A man came to clinic at midnight. I mean, it was about 2 a.m. He asked me to prescribe one drug for headache and high blood pressure. You know, I don't know about other countries. Please, if there is anyone in any other country, tell me, please, that is it common in your country that someone comes and tell you the symptoms of a person and ask you to prescribe a drug for him? Unfortunately, it is common in Iran. So it is common that comes and ask more drugs to have in their home or for their father, for their mother, for their friend. Unfortunately, it is common. So he came and asked drug for her husband. I asked why your husband is not here. She had to came here by herself, but the man said that she cannot come because she's sitting a baby at home. I said okay, she can take baby with herself and comes here. He said, oh no, the baby is newborn and she cannot take her with me, with herself. So I was thinking about it. A newborn, it means that the woman delivered recently. I said, how old is she or he, the newborn? I mean, he said he's 5 or 10 days or 10-day-year-old. I'm not great in English, so I'm so sorry if I had some grammatically or maybe other wrong words. What do you think? A woman have headache and they measure her blood pressure. The blood pressure is 15 centimeter of we say Hg, I don't know in English, and she has not any past medical history of hypertension, but she may have experienced this kind of headache before, but she had not any history of hypertension or high blood pressure in the period of pregnancy, and she has not any similar headache in pregnancy. So what do you think about it? Because I was talking with Misag. Misag is one of my friends that works in a hospital that is special for women, for delivery, for pregnant women. And we were talking with each other, and she said, oh, we had a woman with headache and the doctor was told, okay, she's not pregnant, she has delivered 10 days ago, so she's not pregnant now. So I do not think about preeclampsia or eclampsia. And she didn't admit that patient And soon after that, the patient came with seizure. She described this situation for me as a friend when we were talking together. And at that night, at 2 a.m., when the man was talking to me and was asking me, actually was begging me to please give me a drug for headache and hypertension, for headache and high blood pressure that doesn't affect the breast milk, and does not have any harm for the baby, for newborn. That memory came to my mind and freeze my mind, and I said, oh yes, maybe the woman has preeclampsia, and maybe she is in risk of seizure, in risk of eclampsia. I told to the man, please go to the hospital. He said it's hard to go there for night because that time, because they will admit my husband, but I prefer, they admit my wife, but I prefer not to, she prefer not to be admitted because of her newborn. I said, okay, it is important, it may affect your life, but please send her because she had to go there. It will be dangerous for her. She said, okay, tomorrow morning we will go to the hospital. Please now give me a drug, give me a treatment. But I said, maybe tomorrow morning is late. It would be easier separate mother from newborn for one night. It is better to do it than separate them for all over the world because of eclampsia, because of seizure of the mother, or because of any harms that may happen to the mom. After a week, I didn't prescribe any drug. Fortunately, I didn't prescribe any drug for the mother, but I saw them next week, and fortunately they went to the hospital at that night, and fortunately they admit her with the diagnosis of preeclampsia, and everything got okay.